antimicrobial resistance has increased over the years in low resource settings because of the aspect of overuse of antimicrobials or unnecessary use of antimicrobials. And there are various factors that drive this overuse. And among the factors that drive this overuse is the fact that in low resource settings or in low middle income countries, a lot of population does not have good access to healthcare services. My name is Faith Silla. I am a critical care and emergency nurse, currently working at Mayo Teaching and Referral Hospital in Eldoret, Kenya. We are very grateful for the opportunity to speak about the article that is titled A Call for Global Collaboration to Tackle Antibiotic Differences, Antimicrobial Resistance in Low Resource Settings. The whole concept of trying to bridge the gaps through global collaborations in tackling antimicrobial resistance and reducing antibiotic consumption differences across different resource settings has been a growing concern. It's either because of the lack of finances to have those proper clinical consultations before consumption of antimicrobials, or the distance that they have to cover to seek proper healthcare or reviews in order to get the proper prescription of antimicrobials. And there are also no good national policies that or restrictions that restrict the use of antimicrobials. Our specific project was tailored on utilization of surgical site infection prevention bundles to reduce the rate of surgical site infections post-cesarean section among our local communities. And we believed and were able to establish that by using these standard infection prevention control bundles, we can reduce the rates. And if we reduce the rates of surgical site infections post-cesarean section, that means less length of stay for the mothers in hospital. That translates to less consumption of antimicrobials because we do not have the infection to treat. So there's no excessive use of antimicrobials among these mothers that are already breastfeeding. And there's no disruption of the family processes, improving family-centered care because the mother will not get a surgical site infection. So they're able to stay with their baby throughout the postpartum period and take care of them. Unlike where the mother develops a surgical site infection post-cesarean section, they have to be readmitted to the hospital, disrupting the family processes in that case. So what most settings like ours and even lower level facilities, because I work in a tertiary hospital, what other levels of our cadre and lower level facilities could embrace is utilization of infection prevention and control bundles, because they are able, not just for surgical site infection, but for other infections like the catheter-associated urinary tract infection, the central line bloodstream infections, and other catheter-related bloodstream infections. They can utilize the infection prevention control bundles to reduce these hospital-acquired infections. In return, there will be reduced consumption of antimicrobials. And we all know the less we expose our bodies to antimicrobials, the better the chance of reducing the probability of resistance, because as much as we expose microorganisms to an antimicrobial, they will find ways of survival. Talking about the different projects that have been done under the single umbrella aim of curbing antimicrobial resistance from 3 different parts of the globe is very, very significant, because at least different populations could see that their inherent challenges are not unique to them, but also exist in other parts, but we can all contribute towards curbing antimicrobial resistance by facing the different or similar challenges that we face across the different continents of the globe. It has been a lot of effort from different healthcare providers across the globe trying to put together projects and interventions with great funding from different foundations, especially the Pfizer Foundation, trying to improve population health and curbing antimicrobial resistance. And we really invite our viewers to look out for these articles in the next Mayo Proceedings publications, that is the October 2025 issue. Kindly look into those articles, see what our findings were from the rigorous research processes that we put in place across the different continents.
We hope that you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel, www.youtube.com Mayo Proceedings, or journal updates on Facebook, www.facebook.com Mayo Clinic Proceedings. You can also follow us on X, formerly known as Twitter, available at Mayo Proceedings. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This content is copyrighted by Mayo Foundation for Medical Education and Research, published by Elsevier Incorporated. All rights are reserved, including those for text and data mining, AI training, and similar technologies.